Hello and welcome to the Principles of Exercise Therapy assessment process for the year 2021-22. So we're just going to tell you about the exams. So the computer assisted assessment is on the 5th of May at 2 o'clock. I believe that's for full and part-time, although watch this space. And then the Vivas for the full-time will be on Wednesday and Friday, the 25th and 27th of May. And then the part-timers, your exam will be on Thursday, the 26th. Times will be released closer to the date. So the PET assessment consists of a 45-minute computer-assisted assessment, the CAA, of which you'll be asked lots of questions in a short period of time. That is an online assessment, and that makes up 30% of your total marks in the PET module. And then the PET VIVA, this is where the lion's share of the marks are, 70% of the marks here, and this is a 30-minute exam with 10 minutes preparation time. Obviously, you're required to get a 40% pass in each of these. Otherwise, unfortunately, you're going to have to resit. Although you lot so clever, I don't see that happening. So semester one, let's just take you that all the way back in September. We went through why should we exercise, the components of fitness, functional movement, the principles of exercise therapy, doing a needs analysis, and then we talked about communication and feedback in the exercise arena. Then we talked about prescribing exercise, and then rehabilitation planning, acute, subacute and chronic. That's early, mid and late stage rehabilitation. Then we talked about appropriate outcome measures, because if you're not assessing, you're guessing, and then muscle physiology. Semester two will be about flexibility, strength and balance as the most important components of fitness, particularly for acute rehab, and then onto biomechanics, the cardiorespiratory system, designing group exercise, cardiac rehab, and the practice VIVA session. So this year's case studies consist of the following four areas. Sam, who is an ACL reconstruction, a knee patient. Bethany is an ankle patient. She's inverted her ankle. And then Eleanor is a frail faller, okay, who's hurt her hip. And then we've got cardiac rehabilitation. Now, within this, we've got 5 patients within the cardiac rehab group, but they're all there for cardiac rehabilitation. There's just a little bit of difference between each of their stories. So Sam has reconstructed, he's just had a reconstruction of his anterior cruciate ligament on that right side. So think about the length of time that it's going to take for an ACL reconstruction to return to football, for example. It's going to be much longer than you think for him to safely return. Bethany, she's inverted her ankle, so we're going to have to think about how we do her preparation. Again, early, mid and late stage rehabilitation. And then we've got Eleanor, who's our frail faller. She's fallen over, she's hurt herself, and she's got sort of pain inhibition where she fell on her hip. And then we've got the cardiac rehabilitation. You've got 5 patients within this. You've got Ahmed, you've got Jeffrey, you've got John, Natalia, and you've got Peter. So you should be using either PhysiTrax or Rehab Guru to help you with your exercise prescription. So you can literally just type in, knee or ankle or hip, and you'll get a wonderful variety of programs at the acute stage, at the subacute stage, and the chronic, early, mid, and late stage rehabilitation. So you can plan your exercises for the components of fitness that you think they require. So the PET VIVA, on the day, you will be told which of the 4 case studies you've got, and then you're going to be given 10 minutes preparation time for you to prepare some of the questions that you'll be given about exercise prescription. Then you're going to do a 30-minute exam, and you're only allowed to bring in 1 sheet of A4, just like the other exams. And then the tutor's going to ask you some questions. There might also be a tutor watching who's moderating the tutor and not you. So what does the exam format look like? So you're going to spend 5 minutes discussing the problem lists, minimum 5 problems, then the goals and a plan about how we achieve those goals. So short-term and long-term goals. Then you're going to demonstrate 2 prepared exercises from your exercise rehabilitation program, and you're probably going to progress or indeed regress one of these exercises. You might get to do another exercise, and you'll certainly get to do a demonstration of a relevant outcome measure. And I emphasize the word relevant. Then you'll be asked questions. So that's the practical side. So just make sure that you're using the acronym IDEA. So we introduce the exercise, then we demonstrate it, then we get the patient to execute it, and then we adjust them. Do not be afraid of getting hands on your patients. Facilitate their movement. It will not be optimal. That's why you are a physio, the power of kinesthetic feedback. So then we're going to discuss the principles of exercise therapy and how you implemented those principles into your examination. Then we're going to talk about things like the needs analysis of that patient in early, mid, and late stage rehab. And of course, safety considerations, precautions, and contraindications for things like stretching and cardiac rehab. And then there's an additional 5 minutes where we can ask you anything from the PET syllabus. So individual case studies, you're going to have 5 minutes in the exam to discuss this. We want a minimum of 5 problems using the biopsychosocial method. Okay, so if you can have 2 from the bio, 2 from the psycho, 2 from the social, and you're well over your minimum of 5. Then from your problem list, you're able to formulate short-term goals for acute or early stage rehab, and then long-term goals for late stage or chronic rehabilitation. The goals will be different, won't they? So short-term goals may be returning strength, maybe returning range of movement. Long-term goals about returning to work and returning to sport. So individual case studies, you're going to be given 2 exercises, maybe even 3, about addressing particular components of fitness based on the case study. So there's no surprises. You're going to be able to progress or indeed regress these exercises accordingly, and then demonstrate that relevant outcome measure, just making sure that the outcome measure is appropriate to the patient case study. You then have 10 minutes to kind of justify what you did. Obviously, we want to be thinking about safety and contraindications at all times, probably listing 3 to 5 contraindications for things like stretching or cardiac rehab. Justifying why you did those particular exercises is the key. And knowing which stage of rehabilitation you're doing that. And then how did you apply those principles of exercise therapy, particularly things like overload, okay, or putting things like how much rest and recovery between exercises, so on and so forth. So if you get the group case study, this is slightly different because you're going to be demonstrating a patient a class, although you're not going to be doing it to a class, you're just going to be using one other student, and you might demonstrate a warm-up or the cool-down, and you're going to demonstrate exercises from the main body as well, and of course a relevant outcome measure for cardiac rehabilitation. So all the questions we always get, like, do we have to learn all of the 5 patients? Yes, of course you do, but the patients are all very similar. So they're all there for cardiac rehab, but they've just got different stories about how they got there. So just recapping, 5 main problems based on a needs analysis of the individual and the tasks they need to do. Okay, minimum 5 problems. Then we're going to identify 3 SMART goals. Just remember, they've got to be specific, measurable, achievable, realistic, and timed. 3 short-term goals, 3 long-term goals, and discuss your rationale why you've chosen these goals, thinking about the biopsychosocial model and things like cultural perspectives as well. So what level of detail do we require? So everything is always based on the needs analysis of the individual, the task, and the components of fitness that they require. So the task is got to be meaningful to them. Okay, so for Eleanor, might be going back to bowls or climbing the stairs. for Bethany returning to netball, for Sam returning to football. Got to think about the 4 P's of functional movement when we're prescribing a functional movement exercise, and of course that relevant outcome measure to make sure that we're not assessing to make sure that we are assessing so that we're not guessing. Obviously, the component of fitness will be different depending on the stage. Things like strength, balance, and flexibility will be early in the rehabilitation. Things like power, things like accuracy, things like coordination, much later in the rehabilitation plan. What exercises are you going to prescribe for them based on what stage of rehabilitation they require? Progressing and regressing that exercise, things like a squat, regressing that would be a sit to stand. Progressing that, you could do a single leg squat, although that would be quite a progression. We've got to give them time to adapt to the overload principle. So adaptation and overload go together. They go hand in hand. Remember, spot, specificity, progression, overload, and timeout, making sure they've got enough time to heal. So other areas that we're looking for, anything when you're relating to the case study. The case study is a person. So try and think about that holistic, that biopsychosocial approach about how injury is going to affect their psychology and their social life. Obviously thinking about contraindications and precautions. Your communication as well is really important. Remember, idea, introduce the exercise, demonstrate the exercise, patient executes the exercise, and then you adjust the patient. Okay, that's how you always do business. That's the best way of doing things. And we're looking for the skill of you teaching that exercise. So you're going to have to practice things like a warm up and cool down, maybe in front of the mirror or video yourself doing something like that. And we want to be thinking about safety at all times. So if you need any support, there's all the answers as always on Blackboard. There will be a practice computer assisted assessment that will be available to you in April. We also have a mock VIVA where you'll be doing the case studies of Justin and Cedric. This will get you used to the type of questions that will be asked and the structure of the exam. So nothing's a surprise to you when you do the exam. Obviously, you have an entire revision session and practical exam on this. So just to get you used to the flow of the examination process, loads of online resources. And just before I go, obviously you can email me all the way up till the end of March. Wish you all the very best for the exam. It's been a privilege and an honor teaching you, and I wish you well in the future.